spending on healthcare in Ireland, if you combine public and private spending on healthcare in Ireland, it's above average in the OECD, yet the actual quality of the healthcare received is dysfunctional. And I mean, I think there's a deep dysfunction within the HSE. There's probably a lack of desire to reform that in the Department of Health. I mean, it should be recalled that one of the key recommendations of Sláintecare Healthcare was that responsibility for implementing it be driven from the Department of the Taoiseach, because that was what would be required to bring about the type of reform required. Instead, it was landed in the Department of Health with a minister who is expected to deliver that at the same time as dealing with the once-in-a-century pandemic. I just don't think that's feasible. When Tony Blair and New Labour came to power in Britain, one of their key electoral promises was to reform the NHS, and that was driven from number 10. I mean, it wasn't the Department of Health that drove that. It was the Prime Minister's office, and I think that's going to be required here as well. One of the key recommendations of Sláintecare was the separation of public and private healthcare, not the abolition of private healthcare, but the separation, and that it be taken out of the public healthcare system. I don't want to mischaracterise Professor Crown, but I do think one of his oppositions to Sláintecare is exactly that. He thinks that separating the two isn't necessarily a good idea. But I mean, that's achieved cross-party support in the Dáil, and it's also the model that's operated pretty much across most of Europe at this stage. There's a lot of other recommendations that haven't been implemented. I mean, one of the most basic ones was an integrated IT system where you can have somebody being treated in a hospital and then they're moved to a separate hospital even within the same area, and there's no record whatsoever of the treatment they received in the previous hospital.
Whatever about integrated systems between hospitals, individual hospitals don't have systems that are up to scratch.
That's kind of very serious medical effects if treating clinicians aren't aware of treatments that people have received recently in other hospitals. I mean, and we're talking 2021, and where people are carrying around charts. Elderly people are being moved, elderly patients being moved with charts in their arms between hospitals. A lot of money is being spent on our healthcare system, but it's been very poorly managed, and there's very little accountability within the system for how that money is spent. There are people going to extraordinary lengths to do their jobs, and there's no particular reward for that. And then there are other areas where performance doesn't meet the required standards, and there's no penalty for that. Sláintecare was supposed to address that and isn't, and there seems to be a resistance to reform within the healthcare system.